Welcome back to the Legal Code, the channel dedicated to discussing various legal topics circulating or which should be circulating. On this channel, we discuss not only legal topics in pop culture and current events, but also legal topics confronting our culture and society from which we can learn. If you like that sort of thing, don't forget to like and subscribe, as well as share this video with anyone to whom you think would be helpful. Now let's get into this video. We are weeks into New York adopting draconian mandates across the state, not just in New York City, but also in Long Island and upstate New York, which are affecting people's ability to work, attend restaurants, attend social events, and the list goes on and on. The mandates require that in order for people to return to work, they must be vaxxed or face termination, especially in healthcare and education. And New York has the largest public school district. These laws have already gone into effect, and we are seeing the results. As written, New York's mandate applies to all people who work in hospitals and nursing homes, as well as educators, and does not allow for healthcare workers or employees to opt out with weekly testing. So during the last 2 weeks, people were forced to choose either between getting the jab or keeping their jobs. Not an easy choice for many. There were provisions for medical exemptions, but not exemptions based on religious beliefs, because New York did away with religious exemptions in 2019. The disgrace, Governor Cuomo ended religious exemptions in June 2019 because at the time there was a growing measles outbreak, the worst the U.S. has experienced in decades, and he saw the exemption as a barrier to eradicating the disease. And here we are, 2 years later. Thousands of healthcare workers who refused vaccinations lost their jobs under trying to use the religious exemption. This prompted hospitals to cancel selective surgeries and close operating rooms and outpatient clinics because there was not enough staff. Many nursing homes have also stopped admitting new patients because it was already taxed and understaffed even before the mandates went into effect. Therefore, this presents an already worsening situation in healthcare. Workers who were terminated filed several lawsuits last month to challenge the mandate before it took effect. 17 healthcare workers, represented by the Thomas More Society, a legal group that advocates for religious freedom and liberty, said that being forced to take the vaccine would violate their religious beliefs. On September 14th, only a few weeks ago, a U.S. District Court Judge David Hurd in New York issued a restraining order preventing the state from sanctioning a facility that honored religious exemption requests. Judge Hurd at the time said he would rule on whether to continue the temporary restraining order on October 12th. Several healthcare workers who sought religious exemptions from the vaccine mandate said that they were Christian who believed that their bodies were sacred and holy, and that they would avoid medicinal intervention by means of this vaccination. Others, including the plaintiffs in the Utica case, said that they were Christians who opposed abortion and would not take available COVID-19 vaccines because they were developed using fetal tissue. So just so you know, I'm not a doctor. This is just science I'm providing. That cell lines derived from fetal tissue that were aborted, often decades ago, are routinely used in medical research, including in the development and the production of the COVID-19 vaccine available in the United States. Now, fetal cell lines have also played a role in the development of vaccines against diseases including polio, chickenpox, hepatitis A, as well as shingles. Now, a spokesperson for the New York Roman Catholic Church said that the Vatican has determined that in the absence of ethically irreproachable COVID-19 vaccine, it is morally acceptable to receive the existing COVID-19 vaccines. The spokesman also noted that Pope Francis was quoted in saying, "I believe that morally everyone should take the vaccine." Despite getting approval from the Vatican, I hope New York legislators know that Catholics are not the only religious group in New York to be considered in this policy. Nor is it fair to solely be deferential to one religious group while not listening to perhaps dissenting voices of others. Just because the Vatican says it's okay with it doesn't mean other religious groups agree with this. For example, those guidelines are more complicated when it comes to Judaism than in Catholicism. In Catholicism, where doctrine is set centrally, the Pope has endorsed the vaccination requirement, therefore it's universally accepted among Catholics. In comparison, in Judaism, major denominations issue guidelines for their members, but individual rabbis make rulings for their communities, and disagreements are common. In the Orthodox world, where public health guidelines related to COVID-19 have been hotly debated, there's actually a list circulating on social media of Orthodox rabbis who have expressed dissenting or opposition to the vaccine, either publicly or privately, including some in Borough Park, which is a community in Brooklyn that's heavily populated with Jews. While healthcare workers await the court's decision regarding religious exemptions, employers have fired people who sought religious exemptions, while others have kept them on payroll, often with additional testing requirements. So how does New York plan to address staff shortages that are naturally going to be the result of these mandates? Well, New York is looking to the National Guard as well as medical professionals from other states and countries to help ease as there's this transition. The governor has also signed an executive order allowing practitioners from other states to work in New York, also recruiting retirees to come back to the healthcare workforce. Now, facilities already have difficulty recruiting and retaining staff because of being overworked, underpaid, not to mention the poor quality of life experienced by many healthcare workers as a result of the pandemic. So the governor will be hard pressed to make an attractive offer in order to recruit talent from retirement or from other states. Therefore, this mandate can devastate the healthcare system, because if the judge upholds the mandate and healthcare workers refuse to return, then what? Will there be enough employees on reserve to be able to fill the gap? What is the long-term plan? Even if emergency personnel are brought in as a contingency, how long will that last? How long can it last? With fewer staff, you cannot expect the quality of service to be the same or to be even sustainable indefinitely. Now, you may be wondering, can these workers seek unemployment benefits that they should be entitled to it? No. The state's Labor Department has issued guidelines clarifying that workers who are terminated because they refuse to be vaccinated will not be eligible for unemployment insurance, absent a doctor-approved request for medical accommodation. So this is the caveat. If a healthcare worker was fired because he or she produced a medical exemption, then she will be allowed to collect unemployment benefits in New York. But anyone else, if they fall under the religious exemption criteria, they will not be eligible to receive unemployment, and they will be disqualified from receiving this state benefit, even though they've paid into it. Now, New York is not the only state mandating vaccines for healthcare workers. California announced similar policies over the summer, and the U.S. Department of Veteran Affairs is also requiring frontline healthcare workers to get the jab. So while we are waiting for federal court in New York to make this determination for religious exemption, the court has already decided for teachers and administrators that work in the educational system of New York and said that they cannot seek the protection of a religious exemption. So we are seeing that the governor sanction the firing of educators who refuse to receive the jab. Is this policy a surety against the spread, as well as being a surety of school closures, because there will not be enough educators for our children? If there were not before, it's exacerbated even more now. Even though lawyers for teachers argue that teachers who are placed on unpaid leave because they have not complied with the order will be irreparably harmed, this rationale and reasoning has been insufficient in both the district court and the appeals court. And so the court has upheld that the mandate stays. Also, even in saying that thousands of children will be out their teachers, that's still not enough to compel the court to side with these teachers. This reason was not enough for the district court to support the teachers who decided that the vaccine was not right for them. So, as you can see, there's a great divide that continues in the state, in the nation regarding these mandates. And we will continue to see this divide because these policies have forced frontline workers to become deputies, which is no easy task with such a contentious topic. And so that is it, and we will wait and see how New York handles this. And with that, thank you for watching. If you have any questions, drop that in the comment section, and don't forget to like and subscribe and comment below. Thank you.